Old age hearing loss or presbycusis is a gradual and progressive decline in auditory functions that occur as a natural part of aging process. It typically begins around the middle age and worsens over time. Unlike sudden hearing loss, which can result from trauma, infection, presbycusis or old age hearing loss develops slowly and affect both the ears symmetrically. This means that both the ear experience a similar level of hearing loss. The decline in hearing ability primarily affects high frequency sounds, making it difficult for the individuals to understand speech, especially in noisy environments. Presbycusis or old age hearing loss is one of the most common health conditions affecting older adults and can have significant implications on the communications, social interactions, and overall quality of life. The causes of old age hearing loss or presbycusis are multifactorial and can involve various physiological and environmental factors. Number one factor is the age-related changes. As the individual ages, the delicate structure in the inner ear, which is known as the hair cells and nerves, which are responsible for transmitting sound signals to the brain, naturally deteriorates. This age-related degeneration leads to a gradual decline in the hearing sensitivity. Number two is exposure to loud noise. Prolonged exposure to loud noise over lifetime, such as occupational noise, recreational activities like orchestra, attending to concert or using a power tools for hearing, and environmental factors like traffic, construction noise can damage the hair cell in the inner ear and can contribute to hearing loss in the later part of the life. Number 3 are genetic factors. Genetic predisposition can play an important role in determining individuals' susceptibility to presbycusis or old age hearing loss. Certain genetic variations can make some individuals prone to age-related hearing loss than others. Number 4 are medical conditions, which are chronic health conditions including diabetes, hypertension and cardiovascular disease, as well as ototoxic medication which can impact blood flow and nerve function in the inner ear, exacerbating age-related hearing difficulties. Number 5 is smoking, which can be linked to increased risk of hearing loss in older adults. The harmful chemical in tobacco smoke can damage blood vessel, nerves, including those in the inner ear also. Number 6 is ototoxic medication. Some medications like certain antibiotics, chemotherapeutic drugs, non-steroidal anti-inflammatory drugs, NSAIDs, have ototoxic effect, meaning that they damage the structures of internal ear and contribute to hearing loss. These factors can interact and compound over time, leading to varying degree of hearing loss in older adults. Understanding these causes are essential for implementing preventive measures and interventions that mitigate the impact of presbycusis on individuals' quality of life. The test of old age hearing loss and presbycusis aim to assess the type of hearing loss, the severity of hearing loss, and the extent of hearing impairment. Here are two common types of tests used. Number one is the audiometry, which is the primary test used for evaluation of hearing loss. During this test, the patient wears a headphone and sits in a soundproof booth. The audiologist presents various tones at different frequencies and amplitude to each ear separately. The patient has to indicate when they hear the tones by pressing a button or raising their hand. This allows the audiologist or the ENT doctor to measure the softest sound the patient can hear at various frequencies, creating an graphical audiogram which represents the result of the audiometry. Audiometry helps in determining the degree and pattern of hearing loss, whether it is conductive hearing loss or a sensory hearing loss or a mixed hearing loss. The conductive hearing loss is caused by middle ear pathologies, whether the sensory hearing loss is caused by the nerve deafness. That means it measures both the bone conduction and the nerve conduction also. Number two is tympanometry, which assesses the health and function of middle ear, including the eardrum, which is also known as tympanic membrane, and three small bones, which are known as ossicles, responsible for transmitting sound vibration. During this test, a probe is inserted in the ear canal and air pressure is varied to measure how the eardrum respond to the change in pressures. Tympanometry can detect abnormalities such as fluid behind the middle ear, which is indicative of a condition called as otitis media or serous otitis media. It can also denote perforations in the eardrum or problems with the ossicles. It helps to differentiate between the conductive and sensorineural hearing loss and guides further diagnostic and treatment decision. These tests, along with a comprehensive medical history and physical examination, provides valuable information for diagnosing presbycusis and developing an appropriate management plan. Early detection through regular hearing screening programs can facilitate timely interventions such as hearing aid and assistive hearing devices to improve communication and quality of life for age-related hearing loss. Now, the management and treatment strategies for old age hearing loss or presbycusis aims to improve communication, mitigate the impact of hearing impairment on daily functioning, and enhance the overall quality of life. Here are some approaches for doing this. Number one is the use of hearing aid. The hearing aid are the most common effective treatment for presbycusis. These devices amplify sound, making it easier for the individual for hearing loss to hear and understand speech and other environmental sound. Modern hearing aid comes in various sizes and technologies, including the behind the ear hearing aid, which is known as BTE, or in the ear hearing aid, which is known as ITE, or the complete in the canal, which is CIC options are also available. They can be programmed to amplify specific frequencies based on the individual hearing loss profile. Number two are assisted listening devices, which are designed to improve hearing in specific situations such as watching television, using a telephone, or listening in a noisy environment. Examples include amplified telephone, caption telephone, FM systems, and loop systems. ALD work in association with hearing aid or independently to enhance the sound clarity and speech understanding. Number three are cochlear implant. For those who have severe to profound hearing loss who do not benefit with hearing aid, cochlear implant may be an option. Cochlear implants bypass the damaged inner ear and directly stimulate the auditory nerve, providing a sense of sound stimulation. Candidates for cochlear implant undergo comprehensive evaluation to assess their suitability for the procedure. Number 4 are communication strategies. Speech reading like lip reading, learning visual cues, and practicing effective communication strategies can help the individual with hearing loss to better understand the conversation and participate in social interaction. Techniques such as facing the speaker, reducing background noise, and using gesture or written communication can facilitate communication exchanges. Number 5 are lifestyle modification, that is making adjustment to the environment such as reducing background noise, using captioned media, and utilizing visual alerts for doorbell and alarm can improve the accessibility and safety for the individuals with hearing loss. Number 6 are regular monitoring and follow up with your audiologist or your ENT specialist, which is essential to monitor the changes in hearing function and adjust hearing aid settings and explore new treatment options as needed. Number 7 is counseling and support, including education about hearing loss, coping strategies, and psychosocial support can help the individual and their families navigate the emotional and social challenges associated with hearing impairment. Now, customized management plan tailored to the individual hearing needs, lifestyle, and preferences can optimize outcome and empower the individual to actively engage in their daily activities and social interaction despite the changes of presbycusis. Old age hearing loss can significantly impact mental health in several ways. The number way is social isolation. Difficulty hearing and communicating effectively can lead to social withdrawal and isolation. Individuals with hearing loss can avoid social gathering, conversation, and activities once they used to enjoy due to fear of misunderstanding and a kind of embarrassment. The social isolation can exacerbate the feelings of loneliness, depression, and anxiety, leading to further withdrawal from the social interaction and a reduced quality of life. Number 2 are communication strains. Struggling to hear and understand conversation can be a mentally exhausting and frustrating job. Constantly straining to follow the discussion can lead to increased stress, irritability, and fatigue. Over time, this communication strain can contribute to feeling of frustration, isolation, and impact overall mental well-being. Number 3 are cognitive declines, which suggests that there is a potential link between untreated hearing loss and cognitive decline, including conditions like dementia. The brain cognitive resources are diverted to compensate for hearing loss, potentially impacting cognitive function over a period of time. Additionally, social isolation resulting from hearing loss may further increase the risk of cognitive decline. Number 4 is emotional well-being. Difficulty in hearing can lead to feeling of an inadequacy, that is low self-esteem and loss of independence. Individual may experience heightened anxiety in social situations, worrying about the ability to follow the conversation, and they appear incompetent to themselves. Untreated hearing loss can also contribute to the feeling of depression and sadness, particularly if the individual feels isolated and disconnected from others. Number 5 are impact on relationship. Hearing loss can have strained relationship with family members, friends, colleagues. Misunderstanding and frustration and communication background may occur, leading to tension and conflict. In some cases, untreated hearing loss can strain marriages and close relation as the partner may become frustrated with communication difficulties and lack of understanding. Addressing the mental health implication of old age hearing loss requires a holistic approach that includes early detection, comprehensive treatment, counseling and support services, encouraging individuals to seek help, providing education about hearing loss and its impact, and fostering a supportive environment can promote mental well-being.